So recently I had a patient come in to the clinic, and she had had an experience with a first acupuncture session that did not go very well. Number one, she had no idea what to expect. She had a fear of needles, and she had not expressed that to her acupuncturist, so that caused her to not have a great first session, let's be honest. And it occurred to me that there are a lot of people that are fearful of acupuncture. One, because they have a fear of needles. They're afraid it's going to hurt. They don't quite understand how it's going to help them. But they also don't know what to expect in their first session. So today I would really like to talk about exactly what you can expect from a acupuncture session, from your very first one to your 50th one. It really doesn't matter. So let's get into it. So the first thing I want to touch on is questions, because your initial acupuncture session, for the most part, is just going to be an initial intake. Yes, like most medical practitioners, they're going to want to know your medical history and your family history, what you're there for, your chief complaint, obviously. But there are going to be some unusual questions that they're going to ask you. They're going to ask you about your sleep, whether you have trouble staying asleep or falling asleep. If you have dream-disturbed sleep, that's very important. They're going to ask about digestion. Yes, there will be questions about your poop. They will also ask about your stress levels and how that might present for you. Some people, when they're very stressed, it presents differently for them. We're all very different people. So tailoring the treatment for you requires that the acupuncturist understand how your stress affects you. Okay, so let's address the pretty common concern of the fear of needles. Now, that doesn't mean that acupuncture isn't right for you. The acupuncture needles, first of all, they are not serrated. They are not designed to cut through your tissue the way that a vaccine or getting your blood drawn. Those needles are serrated. They are designed to cut through your musculature, your blood vessels. They are designed to be very invasive to your body. Acupuncture needles are very thin, and they are not hollow. They are not serrated, and they are designed to move through your tissue without breaking it or cutting it. So you won't have a bunch of holes in you when you're done. So that doesn't need to be a fear. They're very tiny, probably like 2 hairs width is about how much you're looking at. So you will not have puncture wounds all over your body when you're done with a session. Very important. But it is also very important during the session, if there is a needle that feels uncomfortable, whether you feel pain, if there's sharpness, if there's starting to be some numbness, any of these things, tell your acupuncturist so that they can adjust the needle. Sometimes that's all it needs, is a slight adjustment, and that's it. And all of a sudden, that sensation that you're feeling has gone away. So please feel free to speak up and let your acupuncturist know if a needle does not feel comfortable. If it continues to stay uncomfortable, they should take it out and the needle no longer needs to be in that area. That's totally fine. Now, one of the things that I do want to let people know is that the fear of needles causes people to kind of tense up. Now, it's kind of an unfortunate feedback loop, right? Because the more you tense up, the more I can guarantee you it's going to be uncomfortable. Staying as relaxed as possible allows the needle to just effortlessly go in. And the more effortless it can move through your tissue, the less likely you are to feel it. Most of the time, most people have no idea I've just put a needle in their body. There are ways of distracting your nervous system so that it doesn't have this fear built up inside of it so that it's making you tense up. So you can stay nice and relaxed while you are having the session. Which brings me to the next point of where should you expect to have the needles placed in your body? Most of the time, especially for pain relief or stress relief, expect that they're going to be somewhere on your extremities, either your hands, your wrists, your elbows, your feet, calves, lower legs. They will be somewhere on the extremities. There's also a very high chance that, especially if you have neck or back pain, expect to have needles in your neck or along your back, somewhere where you're feeling that tension. If you're coming for digestive issues or for women's health, then there's a good chance that the acupuncturist might be putting needles on your abdomen. The other option is if you experience headaches, migraines, if you have TMJ, if you have stress, likely you will have needles somewhere on your face, in your jaw, even kind of in the back of your ears, even up on top of your scalp. So needles can be placed pretty much anywhere on the body. There are thousands of points. I really like doing needles in the ear as well. Auricular acupuncture is a fantastic way of working all sorts of issues. Digestive, stress relief, I mean, even down to addiction and pain. It's fantastic. So there's really no off-limits area with the needles. All right, then comes the resting period. So during this time, after the acupuncturist has maybe cupped you, done some e-stim, all of the needles are in, they're going to leave the room and allow you to rest. Typically, this is your time to meditate, practice your breathing, just kind of center in with your body and allow the healing process to continue. There are a lot of times where people will fall asleep during this time, and that's wonderful. Drooling seems to be a very common experience for most people. But the acupuncturist will leave the room, and you'll have anywhere from 15 to 20 to even up to 45 minutes in the room to just relax, meditate, fall asleep, drool, whatever it is that you would like to do in order for your body to register and kind of communicate with itself and let the magic of the needles start working. There are plenty of common questions. The first one always is, does acupuncture hurt? And again, it's utterly painless. For the most part, you might feel the needle being inserted, but any prick or sensation that you'll feel is very quickly diminished. And the beauty of acupuncture is that your body actually registers this as an opportunity for it to start healing. It indicates that it needs to start functioning and changing things. So feeling it sometimes is a good sensation. It indicates that that area needed that needle. It needed some relief. It needed to have some mindfulness and awareness brought to it. The next common question that I often get is, how many sessions does it take? Now, this is going to vary depending on how chronic of a condition you might have. If you have been dealing with chronic migraines or chronic pain for decades, it might take a weekly acupuncture session for up to 3 months to kind of start seeing results. Now, some people do feel and see results instantaneously. I mean, if I have someone that comes in with a headache, I can usually get rid of that headache with about 1 or 2 needles. But sometimes it takes a little bit of gradual decrease in the number of your pain. If you're at a 6 in neck pain, getting down to a 0 might take a couple of weeks. And then we can back it down to maybe you come in every other week or every month just for maintenance. So that's gonna typically depend on you and what it is that you'd like to work on. Now, I kind of already answered this, but the third really common question is, when will I see results? And like I said, it could be immediate and it could be a gradual over a couple of weeks to a month time. It just depends on you, what it is that you want to be working on, and how long you've been experiencing this problem. So acute stuff usually goes as quickly as it comes, it usually quickly goes. But if you've been dealing with something for a long period of time, the body takes time to gradually work its way out of that. So it all depends on you. But you can have that conversation with your acupuncturist at your first session, at that initial intake. I really hope that this has been helpful. If it has, please hit that subscribe button so that others might start following. Share it with your friends if they are thinking about doing acupuncture as well. The more people that feel confident going into their first acupuncture session, the better experience they are going to have and the healthier they're going to get. The goal is to be as therapeutic and helpful as possible, and having the knowledge to allow them to have the best experience possible is my full and entire goal in this whole video. So I appreciate you watching. If you have watched some of my other videos, thank you so much. It truly means the world to me. If there are other subjects that you would love for me to discuss, please leave them in the comments below. If you have questions about acupuncture or massage or other health-related inquiries, as we're rolling into the new year here soon, I'm really trying to tailor my information just for what you guys want. Any sort of questions that you have, let me know in the comments below and I will be happy to answer them and do full videos on them, whatever you guys need. I hope that you enjoy your first acupuncture session, and if you've already done acupuncture, congratulations. I hope that you're enjoying it. If you've experienced the acu-high, and if you've already done acupuncture, you know what I mean. For those of you that have no idea what the acu-high is because you have not done acupuncture, watch my video on the acu-high. I will leave a link down in the show notes. I wish you well.